What is allergy? Allergy is when something that is normal that enters into your body and your body reacts abnormally. That is called as allergy. And the same thing that enters to a person who is not having allergy is tolerated and there is no body reaction. So something that enters into a body and a body reacting abnormally to that substance is known as allergy. Allergy can be genetic, acquired from parents, father, mother, grandfather, grandmother, or it can be acquired also. So this genetic type of allergy is known as atopic form, and the other one is known as non-atopic form. And it can affect children, newborn, adolescents, and adults. These days, why it is increasing? Why allergy is increasing? Allergy is increasing because of the changes in the lifestyle, our lifestyles, our diet, lack of exercise, exposure to synthetic materials like perfumes, deodorants, chemicals, pollution, lack of exercise. All these factors are contributing to increase in allergy, as well as air pollution, as we see the traffic pollution at the signal junctions, main Hyderabad junctions, which are having highest level of pollutants. That is also one of the important causes of allergy. How can you prevent this allergy? Allergy in children can be prevented by avoiding exposure to dust, keeping the environment clean, preventing exposure to animals like cats, dogs at home, preventing exposure to birds. If you have birds at your home, like pigeons, sometimes the droppings from pigeons can also cause allergy. And the most important allergen in India is pollen, that is grass pollen, that usually starts in rainy and winter season. Avoidance of grass, flowers, dust, all these things can help children in preventing allergy. We can advise children to avoid playing in dusty atmosphere and maintain good hygiene. Avoid junk food like chocolates, ice creams, and things that can cause allergy. Adults, we can ask them to avoid perfumes, deodorants, and avoidance of exposure to pollution, that like road pollution. All these things can contribute to allergy. What are the symptoms of allergy? Let it be children or adults. How they present, how the allergy presents. Allergy usually presents with symptoms involving either eyes, nose, skin, and lungs. Patient can have symptoms of any one organ or multiple organs. It can involve only eyes, or it can be eyes and nose, or it can be eyes, nose, skin, or it can be all four involving eyes, nose, lungs, and skin. Usually eyes, reddening of eyes, itching, watery discharge, nasal discharge, and early morning sneezing. It can be skin rashes. Whenever children goes and plays in the dust, they complain of urticarial rashes, all skin rashes. And of course, cough, breathlessness, and wheezing when lungs are involved. These are the common symptoms of each organ involvement. So, whichever organ is involved, we can contact that particular specialist, like ophthalmologist. Suppose patient is having only eye problem, we can contact ophthalmologist, or ENT surgeon for nasal symptoms. Or if he is having nasal and lung problem, he can contact a pulmonologist. Or only skin problem, he can contact a dermatologist. Why treatment is required? What is the treatment and why the children or the adults should be treated? Children may have recurrent exacerbations of nasal discharge, cough, wheezing every 15 days, 1 month, 2 months. That will hamper their studies. They will not be able to concentrate on their studies. That is the most important part. Apart from that, they may not have the normal development of height as well as weight. They will be lagging behind in the IQ as well as mental development and physical development. Physical development may be reflected in the form of height and weight that will be lagging when compared to children of their counterpart age. That is one cause. Second cause, why the allergy should be treated in adults. It may hamper the normal job activity. The patient will be taking regular leaves, and regularly he will be missing his job, and these things may hamper his normal regular activity. Apart from the normal job activity, the cost of medicines may increase, and the overall effect will be hampering his quality of life also. So in children, it may affect his studies, height, weight, and in adults, it may unnecessarily add up to his cost, as well as it may affect his job. That's why the allergy should be treated. What is the treatment? Treatment can be preventive and curative. So allergy is treatable. How we can treat the allergy? First thing is pharmacotherapy by drugs and non-pharmacotherapic measures. Various drugs are available now. Like the most commonly used medicine is antihistaminic drugs that will temporarily suppress the allergens, the body reaction to the allergens. And depending on the organ involved, suppose eyes are involved, antihistaminics along with steroids are used. The most commonly used medicines are antihistaminic and steroids. Let it be eye involvement, skin involvement, or lung involvement. The two important drugs that work are antihistaminics and steroids. Steroids can be used in the form of local steroids or systemic steroids depending on the severity. So these are the drugs that are used in allergy of any organ. That is one. Second thing is non-pharmacotherapeutic measures. The most important factor in non-pharmacotherapeutic measures is prevention. How to prevent exposure to allergen. This is most important. Try to avoid exposure to allergen. Ask the children to avoid playing in dust. That is the most important thing. If you have pets like cat, dog at home, try to avoid the exposure to cat and dog. Try to avoid exposure to pollens, as I've already told. If you are having a job that is leading you to regular exposure to air pollution on the roads, try to use an N95 mask and avoid exposure to dust and air pollution. And one more important thing is good aerobic exercise, almost half an hour to 45 minutes, 5 days in a week, will definitely help suppressing allergy. Worldwide trials of late have shown that regular aerobic activity of 1 hour per day will definitely help in suppressing the abnormal immune response of your body towards any allergen. So first thing is try to avoid allergen. Second thing, regular aerobic activity. Let it be brisk exercise like brisk walking, swimming, running, or cycling. Any of the exercise which is convenient for you at your home or your job place, you can take that. So first is avoidance of allergens, regular exercise, and pharmacotherapeutic drugs, in which the steroids and antihistaminics are the most important ones. These three measures can help you control allergy. You have many alternative medicines apart from allopathic, like homeopathy is there, Ayurveda is there, Unani medicine is there. So scientific data is lacking. Whichever is helping you can be used.